Hello everybody, my name is Sean Scorbo. I'm running to be your representative in House District 23. About a week ago I posted a video and tried to introduce myself and the concepts for this campaign as far as using social media to discuss important topics for the state of Oregon. I originally envisioned these videos as a way to highlight what we as a district and more importantly as a state can accomplish. However, the past week has been a pretty scary eye-opener for everyone. And I've been purposely silent for really three main reasons. The first is I, like pretty much all of you, trying to figure out what this means for my job, the business that I run, and certainly the jobs that that business supports. Second thing is been trying to figure out what this means, not just for my household, but for my neighbors, my friends, my relatives. And if you are not currently doing the same with everyone in your network, I strongly urge you to start doing that now. That leads me to the third reason that I've been rather quiet. I fully expected that our political leaders, especially at the federal level, were going to put politics aside and start to try and tackle this with rational and logical processes using science as a background. And unfortunately, I have not seen that over the past week. At this point, it's more important to speak up, even though some of what I'm going to say is potential political suicide. A couple things you should know about me before we go any further. One is, normally I wouldn't be referencing my notes here, but I want to make sure that I'm stating things accurately and succinctly. The other thing you should know is I am a retired emergency room physician. Although I'm not an infectious disease specialist or an epidemiologist, certainly in the ER we were usually the first to see outbreaks of disease. It is part of our training. Back to COVID. COVID-19 didn't come from eating bats, but it is thought to have come from exposure to bats in a market environment. The first outbreak was reported in Wuhan, China, and the first cases were reported at the end of December, meaning that most likely the outbreak started a few weeks prior, either in early December or late November. It's important to note that in 2008, there was a similar outbreak of H1N1, also known as the swine flu. In that outbreak, federal officials, the World Health Organization, and the CDC quickly cooperated to help isolate and prevent the spread of the disease, and a vaccine was actually available in the United States within 6 months of the outbreak. In the US with COVID, the official response to this point, and by the way, this is a quote from the Secretary of Commerce, Wilbur Ross, in an interview from January 30th, so a month and a half ago, where he said, quote, "I don't want to talk about a victory lap over a very unfortunate, very malignant disease. The fact is, it does give business yet another thing to consider when they go through their review of their supply chain. So I think it will help to accelerate the return of jobs to North America." That was a cabinet-level White House official responding to a growing pandemic, namely saying that this was going to be a job creator at the expense of another country. At the same time, the White House elected to self-develop test kits as opposed to working with the World Health Organization to improve theirs and deploy it here to isolate and identify outbreaks in the United States. During that same time, the White House called reports of the disease's spread a liberal hoax meant to take down the president. The White House denied having any knowledge about who fired the White House pandemic response team set up after the swine flu outbreak. They have lied and put out false and misleading information about infection rates. They've hurled insults as states asked for help and guidance. And the President of the United States is continuing to say that the anti-malaria drug chloroquine has been approved by the FDA for use with COVID. Unfortunately, that's false on many levels. There is no FDA certification, and there's actually no clinical evidence at this point to suggest that it works in people. But I will say, as a physician, that chloroquine does have toxic side effects. Never mind that fact, because the people that have studied drug treatments for viral outbreaks their whole lives are skeptical, because the president said, quote, May work, may not. I feel good about it. That's all it is, just a feeling. I'm, a smart guy. I feel good about it. And we're going to see, you're going to see soon enough. Unquote. This type of uneducated, uninformed statement causes people to shrug off the virus because there is, quote, already a cure. The president said so. We already missed out on a 10-week head start that other presidents dealing with a similar situation took advantage of. And now we are seeing more misinformation from the head of the executive branch, making the situation worse. In fact, it was not until the president saw a critique from Tucker Carlson, a television personality, that he even changed his tone a little bit. We still have senators that are complaining that we're shutting down the economy for the equivalent of the flu. And here I quote Senator Ron Johnson from Wisconsin in the Milwaukee Journal Sentinel. Quote, "I am not denying what a nasty disease COVID-19 can be, and how it's obviously devastating to somewhere between 1 and 3.4% of the population. But that means 97 to 99% will get through this and develop immunities, and will be able to move beyond this. But we don't shut down our economy because tens of thousands of people die on the highways. We don't shut our economies down because tens of thousands of people die from the common flu." He said, quote, "Getting the virus was not a death sentence except for maybe no more than 3.4% of our population, and I think probably far less," unquote. Let's stop here for a moment. I don't want this to feel like a pile-on for the Republican Party. But again, it's important to recognize BS when you see it, because now it's life or death. If you are complacent and you sit back, you are potentially exposing not only yourself, but those around you to a deadly disease. And the people in power in the federal government, especially members of the Republican Party, are putting their power and wealth ahead of your life. In fact, it was just reported that Senators Richard Burr, Kelly Loeffler, James Inhofe, all Republicans, sold off millions of dollars worth of stock in aggregate after Senate intelligence meetings about the severity of COVID in February. And before Democrats gloat, know that even Senator Dianne Feinstein is potentially implicated in this sell-off. So you have people in power saying that everything is fine publicly, but selling off stock before an inevitable stock market crash. And by the way, this is millions of dollars of stock that was sold off, and there was a focus on selling off stock in the hospitality industry. So you can't tell me that they didn't understand what was going to happen to the economy and to the people of this country. So now that we can see the federal response for what it is, and hopefully you're taking it seriously, the question is, what's the actual scope of the problem? Going back to Senator Johnson's statement that this would kill, quote, only 3.4% of the US population at worst, let's think about what that means. If we practice moderate social distancing, being 6-foot separation in a line, limiting gatherings to no more than 10 people at any one time, not going out when you're sick. If you are sick, certainly using your own contact precautions, washing your hands frequently. That's moderate social distancing. Extreme social distancing would be martial law, shelter in place. You don't go out for supplies, supplies are brought to you. That seems unfortunately rather unlikely in the United States. So the moderate social distancing is probably about the best that we can hope for in this situation. If we were to practice moderate social distancing, it's thought that we would limit the number of people getting COVID to around 30 to 40% of the population before a vaccine, hopefully, arrives in 12 to 18 months. If we go with the 30% number, then we'll see about 100 million people infected in this country. Out of those, 15 million people will be severely ill. 8 million will need to be hospitalized. Another 2 to 3.5 million will die. That's in comparison to the flu that kills about 30,000 people a year and car accidents that kill about 30,000 people a year. If you combine those two numbers, you have 50 plus years of deaths squeezed into 1 year with COVID. You have 50 years of death from flu and car accidents squeezed into 2020, 2021. Let's take that a step further. The number of COVID deaths over the next year could be 3 to 5 times greater than the total number of US combat deaths in all US wars going back to the mid-1700s. So when a government official says it's just the flu, again, recognize the BS. When a congressperson sends Twitter pics of them eating out in a restaurant, again, recognize the BS. When our president calls this an exaggeration, recognize the BS. This is a threat to people in power, and the longer they can string out the realization there is no problem, the longer they have to sell stock, figure out how to stay in power, keep their money backers happy, and generally cover their own backsides. Don't let the public, quote, nothing to see here attitude make you less vigilant. So let's bring this back full circle to the state of Oregon. If we follow a similar scenario to what I described, with 30% of the population getting this, that means that we would see upwards of 1.2 million Oregonians infected with COVID. If we're lucky, that happens over the course of 12 to 18 months so that those cases don't completely overwhelm the hospital system in the course of 2 months. That means that 90,000 people might need to be hospitalized, and potentially 30 to 40,000 Oregonians could die in the next year from this. Before we go any further, also consider the fact that the state of Oregon has fewer hospital beds per capita than any other state in the union. So what happens is those hospital beds fill up with COVID patients. Cancer doesn't go away, heart attacks don't go away, strokes don't go away. Where are they going to be cared for? We have yet to even tally in the increased mortality rate that we're going to see because people don't have access to care, because the hospital system's about to be overwhelmed. This leads me all the way back to why I'm speaking up. I am not here to scare you. I am here to provide a reality check. And despite the fact that I anticipate that some people are going to accuse me of trying to incite panic, I'd counter that as a citizen of this state and this country, we have a right to understand the scope of the problem, even if our elected officials don't think we can handle it. Keeping people in the dark and not explaining the full gravity of this will end up killing more people. Politically, again, it is probably suicide for me to have just called out the current administration. But if I can convince just one person for every 9 votes that I lose about the seriousness of this, I honestly think that that's a win. And if the state of Oregon is going to win in this, we need to act together, we need to isolate, and we need to support our neighbors. Thank you.